the World Bank has approved $3 billion in funding for vaccination in 32 countries, 15 of which are in Africa. As African stakeholders explore ways to recover from the fallout of the COVID-19 pandemic, we'll take a look at how African nations can build resilient healthcare systems with Dr. Dumani Kula. He's the Chief Operating Officer for Africa at Evercare Group, and he joins us now. Thank you so much, Dumani, for taking the time out to join us today. I'd like to just quickly share your thoughts, your own perspective on the response of Africa so far. I mean, we've seen once again, and even before we had the COVID-19 pandemic, we had the Ebola crisis, and that, exposed the state and the vulnerabilities of Africa's healthcare systems and the need, of course, to reinforce and build and prepare for future pandemics. And before, not too long after that, we had the COVID-19 pandemic, and this was even an even bigger blow for Africa's healthcare systems. We've seen that rallying support, especially from developed nations in the area of vaccine, also exposing our weak research and development progress on the continent. Just your thoughts on how Africa has responded so far and the lessons that you believe that we ought to take away from this.
Good day, Esther, and good day to your viewers, and thanks for having us. I think it's a mixed picture. I think, as you say, the continent has been tested on multiple fronts over the years. Ebola we had in West Africa, and I think the key lesson really is that the starting point for Africa is not one that we are the proudest of. With respect to health infrastructure, we're very, very much behind, and that's one of the things that we're trying to solve for as Evercare, is to make sure that we have got a better infrastructure and more accessible health infrastructure on the continent. And so, because that starting point is not as as optimal as it should be, I think really that has been exposed on the continent with respect to how we have responded. And as I say, it's a mixed picture, because if you actually look at some of the the fundamentals of what you are seeing on the ground, is that to some degree, given the health infrastructure that we have, Africa actually has responded relatively well. I think many of the countries, they've fared much better, than they could have. I think we've seen horror stories across the globe in terms of how some of even the most more developed economies have struggled under the pressure of COVID. So I would say there's certainly some comfort that we can draw, that even despite the weaknesses of our health infrastructure, Africa really has done relatively well to make sure that we come out stronger out of this. I think the one thing that is really the clear kind of a message is that when you look at the mortality stats, and you benchmark the mortality stats on the continent versus, other more developed economies, I think there really the vulnerabilities begin to show that, to the extent that we have had, a COVID cases on the continent, we certainly are experiencing higher mortality rates on the continent. And of course, that is not something that surprises us, because we know that it's much more difficult to access healthcare, on the continent. And when you do access it, the quality is at best very variable. But as I said, it's really a mixed picture, Esther.
Now, experts tell us that in building a better, stronger, more resilient and equitable healthcare system on the continent, the private sector obviously needs to be a key player, and it needs to also be integrated across the healthcare chain, especially in the area of financing. You're a private sector player. Talk to us about, innovative financing options or trends that we're seeing, and how African nations can also incorporate the private sector to be a key player.
I think COVID has given us really the opportunity to see that in action, I think, in different parts of the continent. And I would even say across the world, we have seen how private sector, has been working very closely with, governments. And the vaccine itself is a story in point, that how the governments, have poured money into research to accelerate the development phase of the vaccine. And of course, the private sector, that has been undertaking much of that research. We've seen the private sector play key roles in terms of the actual response, here in Kenya, where we have got a number of facilities, both on the primary health care as well as on the acute secondary and tertiary care. We have been on the front line in terms of, the testing of patients, treating them, those who are critically ill, housing them in our ICU facilities. We've been in the forefront in terms of bulking up, the equipment and the oxygen supplies that we need in order to be able to complement what governments, have been doing. So I think it's very clear from COVID-19 that the private sector needs to work very closely with the public sector. And of course, in Africa, as you know, because of the underinvestment in healthcare over decades, the role of private healthcare, is much more pronounced. And as I said, that's really what we as Evercare are trying to respond to with the different healthcare investments we have made in East Africa and West Africa so far.
Speaking about those investments, Nigeria is a market that you've just come into. Talk to us about, I know you obviously did your due diligence and market, looking at market data and all of that before you came in, but talk to us about those lessons that you're learning as you go.
So the line is cutting a bit. I hope you can still hear me, Esther.
Yes, go ahead. I can.
Yeah. So we've opened about 3-4 months ago what now is the largest private hospital in Nigeria. It's in Lekki. We're extremely proud of the work that has been done so far with respect to getting the facility to be open. In fact, talking to our team on the ground, we've been pleasantly surprised really by how quickly we've been able to, to ramp up, in terms of providing the services that we have. We have, north of 30 full-time consultants, who are treating patients across different disciplines. And really the response has been incredible on the part of the communities that we are serving and the people of Lagos. And we take pride in this, and really it's also encouraging to see that as we are putting the investment really is being made, put into good use. And of course, we're looking to expand those services over time. We're looking to roll out more services. As I said, we've got, a broad range of services already, from obstetrics to, the care of newborns, to nephrology, to cardiology that we are doing. We are looking as a next round of investments to do oncology and a few of the other highly specialized services.
Okay, Dr. Okumani, we only have about 1 minute left. I know that there's a blueprint for Nigeria. Very, very briefly, perhaps in 1 minute, talk to us about your plans for Nigeria and plans in the pipeline going forward.
I think for Nigeria specifically, we will of course be looking to make sure that we optimize what we are doing in Lekki. We're going to be extensively looking at additional investments in terms of additional services, but also looking at what we can do, throughout the healthcare value chain, whether that's primary healthcare, but also all the way in terms of how healthcare is funded in the country.